Hi everyone, this is my presentation on body systems, and my name is Jade Montgomery. You might be wondering what an organ system is. An organ system is a group of organs that work together to do a certain function for the body. We have 11 major organ systems working together every day in our body. Let's talk about them now. The first system we're going to be talking about is integumentary. I'm so sorry if I butchered that name, but this system covers our hair, skin, and nails. It's the external covering of the body. This actually protects us from many infections, radiation damage, pathogens, chemical assault, and so much more. It also helps regulate the body temperature. The disease we're going to be talking about is pemphigus. Pemphigus is an autoimmune disease, which basically means the immune system of the body attacks our healthy cells. In this particular case, the immune system produces antibodies against the desmoglein. The desmoglein is a protein that normally holds the skin cells together, but with the antibodies against it, it actually separates the skin cells from each other. So what happens with this, or what are the symptoms? Fluid basically forms between the layers of skin, causing blisters. Blisters in the skin, mouth, nose, throat, eyes, and genitals are very common in this. Early diagnosis is key. Dermatologists then can get a tissue and blood sample to determine if you have pemphigus. So what are some of the treatment plans like? On the lighter side, you have medications like corticosteroids, steroids, and immunosuppressives that stop the immune system from attacking the tissue. If you go a little heavier, you have plasmapheres that remove the bad antibodies from the blood, or you even have immunoglobulin therapy, which replaces the antibodies completely. All right, next up, we're going to be talking about the skeletal system. This includes our bones, joints, cartilage. This supports and protects our internal organs. It also provides structure to our body. The disease I chose to talk about was osteonecrosis. This is when no blood supply makes its way to the bones. The bone tissue then dies, and the bone breaks down and collapses completely. Your body does not reproduce your bone tissue fast enough. Some of the symptoms are pain when weight is put on the joint or foot or bone or wherever your pain is. It can happen in any bone, but your thigh, upper arm, knees, shoulder, and ankle bones are the most common place this happens. You have to get multiple tests to see if you have this disease, including but not limited to X-ray, MRI, CT, bone scan, biopsy. This requires a doctor's diagnosis. What are some of the treatment plans? You can go as easy as medication, like non-sterilized anti-inflammatory drugs for the pain and swelling, physical therapy, basically so you're just constantly moving the joint and trying to get it back and strong, electric stimulation to help regrow the bone. And then if it is at a worse stage, you have core decompression surgery, which increases the blood flow to that bone. Autopsy, which reshapes the bone. A bone graft that takes a healthy bone from another body and replaces it in the bad bone. Or a total joint replacement, which takes the entire joint out and replaces it with a man-made joint. All right, we are now on to the muscular system, which includes our muscles, skeletal, cardiac, smooth. This provides structure, also supports and moves our limbs daily. The disease I chose to talk about was the Duchenne-type muscular dystrophy. Mutations halt the production of proteins needed to form healthy muscles. This causes weak or lost muscle mass. Some of the symptoms found in this are mostly frequent falls, you can't get up easy, hard time running and doing jumping jacks, walking on your toes. It can even lead to learning disabilities, stunted growth, and more commonly, muscle pains. This is most common in childhood boys. It must be diagnosed from a doctor, and there is currently no cure for this disease. Steroid drugs slow the loss of muscle strength, though. Now we have our nervous system. This is like the powerhouse of the body. It holds and controls our brain, spinal cord, nerves, sense, organs, reptors. It's the control house. It controls our body movements, consciousness, creativity, and our senses, and it monitors all other body systems. More nerves are in the human brain than stars in the Milky Way. Can you believe that? The disease I chose to talk about is Alzheimer's disease because of how prevalent it is in media. No one really knows what causes it. It's a possibility that an abnormal buildup of proteins forms around the brain, causing plaques around the brain. This disease causes the brain cells to break down and waste away, meaning no memory, decline in thinking, social, and behavioral skills. The symptoms include memory loss, confusion, and even depression. There is no treatment for this disease. Medication can help temporarily, but as you go along, your symptoms will increase. It is most commonly found in older people, especially women, since women typically live longer. All right, we're about halfway through now, and now we have the endocrine system. This includes our glands, thyroids, pancreas, all that good stuff. This maintains homeostasis, reproduction, growth, sexual development, regulates your metabolism, your water, and mineral balance. We're going to be talking about the Graves' disease. This is when the immune system attacks your thyroid, causing the body to overproduce a thyroid hormone. Hyperthyroidism, or an active thyroid, is what this disease is. It's most common in women, actually, 30 through 50. The symptoms can include, but not limited to, anxiety, puffy eyes, a tremor, a fast heart rate. The treatments are a little bit more extreme with radion therapy, which destroys your thyroid gland cells that produce the thyroid hormone, or thyroid surgery, which removes the entire thyroid in general. All right, now we have the cardiovascular system. This is our heart, blood vessels, and our blood. This system transports nutrition and waste to and from all body tissue. The disease we're going to be talking about for the cardiovascular system is coronary artery disease. This is when arteries harden and get narrow, which leads to no blood flow or lack of blood. Most common death in the U.S. among both men and women. The symptoms are none, chest pain, or even as extreme as a heart attack. The treatment for this can be anywhere from self-care, like no smoking, exercising, a low-fat diet, medications such as blood thinners, or even a coronary stent or coronary artery bypass. You must go to the doctor for testing. Some of the tests might include exercise stress tests, echocardiogram exam, a CT scan. It can range from anywhere. This one's hard to detect as it may just cause a heart attack and you could pass away then. All right, now we have the lymphatic system. This is our tonsils, lymph nodes, and vessels. This protects us against infection and disease. Lymph nodes are actually about the size of peas, interesting fact. We are going to be talking about the Hodgkin's disease. This is when the mutation of white blood cells into B lymphocyst. This causes the cells to grow and multiply uncontrollably. This is pretty much a cancer, meaning you'll have a hard time fighting infections. Swelling in the neck, groin, and armpits are very common. The symptoms can include weight loss, fever, tiredness, lumps. The treatments are more extreme as this is a cancer, including chemotherapy and radiation. Now we have our respiratory system. I'm guessing you already knew this, but this includes the air passages, lungs, navel cavity, and the trachea. This moves air into and out of our lungs. Did you know on average we breathe 13 pints of air every minute? The disease we're going to be talking about for the respiratory system is cystic fibrosis. This disease has gotten a lot of media attention in the past couple years. This is a hereditary disease, which means it's passed down in families, and it attacks the lungs and digestive. Cystic fibrosis causes a thick, sticky mucus, and it clogs the lungs and obstructs the pancreas. The symptoms include a cough, constant lung infections, you can't gain weight, and even a fatty stool. There aren't any cures for cystic fibrosis, but there are some treatment plans such as sodium chloride, antibiotics, dietary supplements, penicillin, and postal drainage. Digestive system is our mouth, stomach, liver, pancreas, intestines. This is where we digest and store food, absorb nutrients, and even eliminate waste. Humans produce about 2 pints of saliva every day in their mouth. So gross. We will be talking about Crohn's disease. Doctors don't know what causes it still. They thought it might be diet and stress, but it wasn't that, but those do aggravate it. It's an inflammatory bowel disease, which means inflammation in your digestive tract. No test for diagnosis. A stool sample can be sent in to see if you have blood hidden in your stool, which then doctors can almost tell you if you have it. Symptoms include abdominal pain, constant diarrhea, fatigue, weight loss, and again, there is no cure. Steroids and immunosuppressants can be used to slow down the disease, though. The urinary system includes our kidneys, uterus, bladder, and our urethra. This system eliminates waste and maintains chemical in our water balance. Did you know the human bladder can stretch up to 400 milliliters to hold urine? Nephrolosis is basically kidney stones. Kidney stones form when your urine contains more crystal-forming substances such as calcium or uric acid. Then the fluid of your urine can dilate. At this time, your urine may lack substances to prevent crystals from sticking together, creating the perfect environment for kidney stones to form. But what are kidney stones, you may be wondering? Kidney stones are hard deposits of minerals and acid salts that stick together in our urine. These can be very painful while passing through our urinary tract, but thankfully they don't cause permanent damage. There are actually some foods linked to kidney stones, including beets, nuts, spinach, and even chocolate, which I know is very sad. What are the symptoms like? The symptoms include severe abdominal pain on the side and nausea. So what is the treatment like for these? You have to get them out of your system, but you can get pain relievers, IV fluids, or even urinary retention medication, which makes you want to pee more. There are a couple surgeries, though, such as extracorporeal shockwave therapy, which shocks the waves and breaks up the kidney stones to make them smaller to help pass through easier. Laser lithotripsy, which uses heat from the laser to break up and remove the kidney stones. And lastly, you also have the ureteroscopy stone removal, which uses a small camera up in your urethra to remove the kidney stone. All right, last but not least, we have our reproductive system. This includes our ovaries, uterus, mammary glands, testicles, prostate. This produces offspring, milk, sperm, ova. Did you know that females can actually birth 35 babies in their lifetime? Like, who knew that? The disease I chose to talk about was endometriosis. I chose this disease because I actually got diagnosed with it about 3 years ago. Endometriosis is when tissue grows outside the uterus. It's unknown what causes it. A possibility is the retrograde menstruation. This is when menstrual blood containing endomine trail cells flow back through the fallopian tube and into the pelvic cavity instead of out of the body, causing that excess tissue. Some of the symptoms include irregular periods, pain in the lower abdomen, and even pain while having intercourse. The treatment plans are different. There is no cure for this. You can do hormone medication. Adding the hormone medication affects the body process by regulating the activity of the organs. There is also laparoscopic surgery. This surgery uses a video camera and thin tubes inserted into small cuts on the body to remove or repair the tissue.